Be the change you want to see in the world, see. We all have things that we see over and over and over again, and we get tired. So here's your chance to have a voice. If you are a creator, you show perspectives that are rarely seen. You are created for change. It's not just us, it's you. We parent from the perspective of wanting to change something. Change something in our history, in your lineage, in your region, in your city, in your neighborhood, or the person next door. This is my opportunity to wake up, rise up, work on me. This is my opportunity, yeah. Wake up, rise up, work on me. This is my opportunity to wake up, rise up, work on me. This is my opportunity to wake up, 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 wake up.
Do y'all see that, like, working with clients, I guess, and especially I think like Princess, when you're working with the HIV positive clients and you're working with domestic violence, do you see differences based on like clients of color? Is it like more difficult for them to access services, or do you see any like?
I never see there's like any differences. It seems like for the most part, from at least for my folks, it's either they like are too lazy to do the part that they need to do to get access to this service, or maybe they just didn't know about it and now they know type deal. Surprisingly, there's a lot of resources for people living with HIV, and so especially here, like National Cares, Street Works. There's a lot of resources, just people don't seem to know about them, and you know, of course, majority of like my black clients use them more than like the white ones do, but I feel like that's probably has a lot to do with like obviously where they live in part of Nashville, and you know, just kind of the kind of supports that they have. I feel like more black people, at least when I talk to them, are less likely to tell their families like what they're dealing with as far as their health. There's a lot of stigma compared to the white people, but overall they kind of have access to the same stuff, and I don't think it's necessarily difficult. Plus, where I work, we have lots of like ways to provide for our clients and make sure they're good and they're okay.
And you were Ryan White. So is that like a standalone clinic?
Oh no. So
is that with Vanderbilt?
Yeah.
I can't remember.
So okay. So Ryan White, like, there's several different clinics around Tennessee, and places to get case management for Ryan White. Like the clinic that I work in is kind of partially funded by Ryan White. The way it was explained to me, our clinic is always in a negative. We don't profit from the work that we do because we're grant funded. So the people that come and get services that don't have insurance, like the providers aren't really getting paid.
Yeah.
You know, these people's services are just getting covered by the grant, and not necessarily the providers are getting paid. Which to me speaks a lot for the providers to work in a clinic like that. And most of the providers, I mean, they're mostly white. And I think oftentimes they do they ask questions, but I think for the most part, since they've got like a long history with like working with people living with HIV and everything, I think they're pretty good there. I like it there, you know. So
I have a question for you. I remember saying that the domestic violence rates have gone up like during COVID, and I've also been, hearing about that a lot. Have you experienced that with your work, like a lot of the domestic violence rates going up?
So, that is a very good question.
Yeah.
And what I would say is that, so before becoming a therapist, I worked at the DA's office. So I had more with the domestic violence unit. So I had more of seeing the calls and all that kind of stuff and responding to the cases and stuff like that. Right now, like being a therapist, I don't do like the intake calls or anything like that. So I can't say that I personally experienced that. I do know like the Office of Family Safety Center and all other domestic violence agencies are doing a very good job responding to it and putting tips out and letting people know how they can remain as safe as possible. But what I have seen is because of COVID is that the shelters, like one that I work at, we're not able to fill all the beds because we have to make sure that even when they come into the shelter that they still remain safe with regards to COVID. So like there's one shelter that has maybe like 3 empty beds, but they have to keep it that way because of COVID guidelines, you know. So that's something I am seeing, but as far as like the increase of numbers or calls, I can't really speak to that because I'm not dealing with that directly anymore. I'm more so there to help the participants with their counseling needs and things like that. So, but that is a very good question. And people are talking about that a lot, and I think it is very real because especially with being in quarantine and you can't leave the house, and depending on who your abuser is and what their triggers are. And I don't even think it's just about like, you know, against women or men. I think about child abuse. I think about sexual assault. Like I think across the board that there's probably an increase in it for sure. And all of that.
And if people, like just bouncing off that, can you give a little information, like if people are experiencing that, maybe you're watching it, like how could they reach out if they really feel like they need some type of shelter, or if they need even just like someone to call or talk to?
So I don't have my phone. I looked at my phone earlier because I knew I should have brought it up here. So I don't have the website exactly in front of me.
Do you want your phone?
No, it's okay.
Oh.
Because what I will say is that if you just Google, like literally Google Office of Family Safety Center, Office of Family Safety Center has all of the resources on there for every domestic violence shelter in Middle Tennessee. They have safety plan lists that you can create and print off. They have one specifically for COVID, which is really, really good, and different tips. Like one of the tips that I really like is that if you are quarantined and you can't leave the house, if you can convince your abuser that maybe you're going to be over a task or something, that you can leave, you know. So, and these tips are also focused on, okay, are you going to stay? Because staying is a real thing. And people tend to turn their nose up at it and judge it, but what people don't recognize is that when the most dangerous time for a person to leave an abusive relationship is when they leave. Like, you know, they are more likely to be harmed or to be killed during that time frame. So staying is a real thing. So you can find these safety tips that are based on, are you going to stay or are you trying to leave your abuser? So there's a lot of good information on there. They have hotline numbers that you can call, even with partnership with like Metro, all that stuff is accessible. So if Office of Family Safety Center, OFS, yeah.
Thank you. That is good information. Talking about how, Princess, you mentioned you feel like Black clients are less likely to kind of share with their family if they're HIV positive. Do you guys see, maybe like Courtney with domestic abuse, do you see those same trends where maybe is there a certain demographic where it's less likely that they're going to like report abuse or get like come into the psychiatric hospital or like come in for a crisis or something like that, or is it you don't really see much of a difference?
Ask the question again.
I don't know what I asked.
distinct? Is there,
Yeah, go ahead.
is there a distinction with clientele between black clientele or patients or white patients when, as far as, for me, an example, in the ER, or you working with domestic violence and AIDS patients. For me, our hospitals are where they are demographically is more so in a white area. So I usually see white patients. So I wouldn't be able to judge whether or not, you know, depending on the area, if you see more or less of people of color or black people. But that's a good question.
Yeah, because I was thinking about access to services and like where psychiatric hospitals are, or just like access to the knowledge about certain resources. So I always wonder who we see more of. Like I know for me in private practice, and it's in Lebanon, which is more rural, like I'm seeing more white patients.
Well, to piggyback off that, in general, do you feel like people, like, do y'all feel like people of color, and it doesn't just have to be black, I don't know if y'all would be familiar with any other populations, are more likely or less likely to go to therapy or seek, psychiatric help? I feel like, well, just coming from my experiences in the black community, that people are more likely, of course, to go to churches, pastors, which is fine too, but I feel like in conjunction with, of course, actual therapy would be nice, but yeah, just more likely to go to church or, the homie, or and things like that, and less likely because of course, the stigma, like, oh, you crazy, what's wrong with you? Why you going to counseling? Like, maintenance? Like, yeah, but I definitely think, especially, I wish there was more, like, I think there's now becoming more black men going to therapy. I feel like that would do a lot for our communities and stuff too.
I've always openly shared that I've been to therapy, and I know when I first was going, my mom was like, well, what's wrong with you? And I had to explain, to her, why I was going, I was like, I'm going to give it a try. She was supportive. And I also encouraged for her and other people to go. And family members like, I'm good. I'm going to pray about it. I was like, that's good. Prayer's good, but you can do both.
Right.
Yeah, you can do both. And because, God, God's going to take you places. But at the same time, this is a tool put on earth. And you need to utilize it, And a lot of times, I know older African Americans, they have a high religion and think that God is going to cure and take care of everything, and that's not the case. And they look down here on earth living in agony, and it breaks my heart that I see my own people, go through turmoil, and they don't have to.
Yeah, I think a lot of it is like the historical mistrust that black people have with the medical profession and healthcare in general, like the things that were done to us. I definitely think that's passed down, like if your grandparents, now I don't know everyone, specific grandparents, but I think with older people, like they were alive, like when the Tuskegee experiments were going on, or like just different things that I don't think we really trust healthcare a lot, and mental health care, and like we talked about in our Zoom call, that like of all the therapists in the US, only 4% are black. So it's kind of that there's nothing wrong with having a white therapist or a therapist, a non-black person of color as a therapist, but sometimes there could be a disconnect of like certain things they might not understand. It's not their lived experience. So I also think that can play a part in there being, especially for black men, there's not very many black male therapists. It's a very female dominated field, so I know that could be a reservation for some men, not all men, because you have a female therapist. But
I was having a conversation with someone yesterday about how if you look at white churches, they welcome. So I work for a nonprofit agency, and a lot of those churches have agreements with this agency to, help their members to go to counseling. We don't see that in the black churches, and black churches definitely need to get into a better relationship with, how can I say this? Get into a better relationship with getting your mental health in line and getting in order. And put counselors in the church, or help your members pay to go to counseling, because the reality of it is you can go to school to be a pastor, but how much education are you getting in mental health? And then when you think about it, some pastors are not even going to school. They may start pastoring first and then go to school afterwards. But
and then they sometimes, not to be shady, but they sometimes qualify themselves as a counselor when they're not always trained to be a counselor, so that could be problematic.
And I think the conversation needs to change. Like my pastor from my home church that I grew up with, he is very, very big about mental health, and he's always saying there needs to be a counselor in every black church. Like, they need to make it a thing. And then black pastors need to become okay with, and it's okay, some of them may have mental health training, but if you don't, you need to say that. Like, don't, like my current pastor, I remember I was talking to him about something, and he was just like, are you going to therapy? I was like, yeah. So he was there to be supportive and welcome the conversation that needed to be had, but he also knew what was beyond his scope. And honestly, if you are Christian and you are going to church, those are the type of people that you want to be leading you. You don't want people that's going to be like, well, just pray it away, because you can't just pray anxiety and depression and PTSD and schizophrenia and you can't pray those things. So bipolar disorder, borderline personality disorder. So wish you could pray, but but like, you can't pray those things. You just can't pray. Faith. When you were talking, Cyrus, I was thinking about, like, okay, faith without works is dead. So you can pray, and then you can also put in the work, and go get the help that you need. Sorry, I took out church for lunch.
I mean, I was ready for it. Okay.
I agree though, and even if they do have training, I mean, let's think about it. I mean, we went to school for years, right? We had to get licensed, we had to take tests. They get training. It's maybe gonna be 8-hour training, if anything, or maybe some Greek, training. But it's not gonna be anything. A lot of stuff is gonna be beyond their scope. One thing, I was looking up the church I went to in Atlanta, Georgia, and it was called Hillside Chapel and Truth Center. And the reason why I fell in love with that church is because of that. They openly talked about counseling. They openly talked about having agreements with counseling agencies and stuff in the community, and they welcomed that, and they spoke about it openly in the church. And that was my first time going to a predominantly black church that spoke about that, and I was like, yo, that's amazing.
What's the name of that church?
Hillside Truth.
That's
Hillside Chapel and Truth Center. It's in Atlanta, Georgia.
I got excited.
But that was the only right. It was the only black church that I've been to that spoke about that, and I just thought that was amazing. And I mean, it was just good to know that it's out there. I just wish it was more common.
I think those two components are synonymous when it comes to information and trust. Because if you don't trust the person that you're talking to, you're not going to listen to the information they have to give. You can't educate them. And I think across the board, in this American society we live in, black people are always behind, and mental health is a part of that. But if we have people that look like us, that are educating us from the pulpit, from whatever aspect of life that black people encounter, and say mental health is important, and here's why. Somebody that's saying that they trust, I feel like it will bring us further along in accepting. And I think we're coming along, but like in every category, I feel like in American society we're delayed, and that's a part of equality. Like, it's not about what we have access to, but it's at the same time, at the same capacity.
Yeah. And it's also like, going off that, like the Maslow's hierarchy of needs that we learned about like freshman year of our psychology or social work is, if my fundamental needs aren't being met, right? Like if I'm living in poverty, if I don't feel safe in my community, if my family system is messed up or whatever, like I'm not even gonna be worried about going to therapy.
Right.
So I think that's also, that can be, I'm not saying at all that all black people are living in poverty, but I think like the marginalized communities, working in the jail or just working with lower income people, sometimes it's like that is the least of their worries.
Yeah.
They're like, I need my medicine, I need my rent, I need my light pay. Like I'm not thinking about going to therapy. So it's also that like once I have access to like all the basic things,
Right.
then I'll make time for therapy.
Yeah.
So I think it's like really good work that everyone in here does, because it's like getting people the basic resources a lot of times and like stabilizing them first, and then now we can like work through trauma and like all those other things.
Yeah. It's hard to sit through therapy when your stomach is hurt.
Oh
Yeah.
when you hungry, shit.
Yeah. I think, I don't know what happened in the black community that, well, yes, I did know what happened, but we have this sense of like, we have to be strong, we have to be resilient. There, nothing can be wrong with us, and I think we also have to be okay with facing our truth and being okay with saying, okay, I'm hurt, I have pain, I'm angry, my father raped me. We have to be okay with getting down to that, and so being vulnerable, really. And I think that kind of keeps people, especially people of color, from going to therapy, because we have this, if you are not strong, then something is wrong with you. If you cry, then something is wrong with you. And I think we need to change that narrative and decrease that stigma, because that's what's keeping us from healing and growing and becoming better.
I totally agree, and it's to the point to where we have to be so strong that where it's killing us, especially in the, women of color in the emergency room, giving birth. It's like because they don't see the signs when they're working, the difference between how they view black women versus other women. They see us as strong, so they don't believe us, or they don't do the same procedures or whatever they do. They don't respond as they should because we are viewed as strong, and it's literally killing us. So it's important for us to be our own advocates, and also to educate them and say, listen, you guys need to treat us as equal. But yeah, it's
That's wild. Like I was thinking, I put that on Google Doc as well. Y'all really wrote the Google Doc, okay? No, I'm just kidding. But that's like so true. Like what happened to Serena Williams? Like she almost died in childbirth because I don't remember if it was a blood clot or something, but she kept telling them like something's wrong and they didn't believe her. And I remember like a few years ago I had read like this comprehensive like research study on like healthcare and implicit bias, and most healthcare providers are white, and just like you said, they superhumanize us or dehumanize us, so they associate like superhuman words and things like that, like just implicitly, and so they don't believe when we're in pain, like they don't rate it the same. Like if they have a white patient and a black patient, same exact case study, same exact symptoms, they'll give two different recommendations based on the only difference is race. So one of the case studies was doctors looked at like two different charts of like a middle-aged man, one was white, one was black, same profile. They came in complaining about knee pain. And for the white man, they just recommended a knee replacement. And for the black man, they said, oh, he needs to exercise, he needs to be more active, he needs to eat healthier, like he needs to try to improve his lifestyle, and then, so they gave like the better treatment to the white person. And I think that's like why it's important to have these conversations and to be like how we are black people in this field, is that there is an implicit bias like that I think you see it now more than ever with police officers and teachers and school board members and all of these things. Like it's not conscious, you know what I mean? Sometimes it is, like you're standing on someone's neck or kneeling on someone's neck is intentional, but I think where I see the most racism in my day-to-day life is implicit bias. It's not anyone trying to like physically hurt me. And so I do think that's really important in healthcare. Like you said, especially as a black woman, like when I have kids one day, that's kind of why I've been thinking, like I would want a black doctor, hopefully like a black woman who's an OBGYN, because I just don't trust that anyone else would probably, if I had an issue, would maybe take it as seriously, because we're dying at like alarmingly high rates, regardless of our education level, regardless of our income level, in the hospital.
I would say, I'm sorry, because I was going to say too, because all, skin folk ain't kin folk. And so they, so I think it's good to like because I am an African American woman that has had 2 miscarriages, and so I have friends that are black female doctors, and so one of them, like, she gave me all the tea and was like, okay, when you get pregnant again, I need you to ask XYZ, and go in and do that. But I think even our own can have implicit bias about us as well. And so I think that even if you don't just trust, okay, you're a doctor of color and you look like me, so you have my best interest at heart, because I don't believe that's always the case as well. And it could be for different reasons. Maybe they do. But I've had an experience with a black female doctor where I'm just like, sis, you're not listening to me. And that just kind of made me feel away. So, but now that I have questions, and so when I get pregnant again, now I'm equipped, I'm prepared, and so I'm quizzing everybody across the board, because you just gotta make sure that they have your best interest. Like, that's like police officers too, because I mean, some of them are worse than white cops when you get pulled over or whatever. So
I was gonna ask y'all about that, having police officers in your family. If you had any type of mixed feelings, because not all police officers are bad, and I think sometimes that's been the narrative, is like, F all the police, but like we actually need law enforcement. So I especially, like, everyone speak on it, but I especially like people that have police officers in your family, and are there any like those worries about their safety and stuff like that, especially like in these times? But
so my dad hasn't been a police officer for a very, very long time.
Oh, okay.
So my guy is out the game, but he did do security for a while, and he just recently stopped doing that. But sometimes you can't get him to realize that you are not a police officer anymore, so I'm gonna need for you to like back, calm down, because he be trying to save everybody's day, and be like, sir, chill out. But no, he's a black man first, and he's a black man that comes from poverty. That his friends that he grew up with are often like, we just knew he was gonna be dead or in jail. So like his whole life turned around when he married my mom, and then he had me and my brother. So I will say there are differences because of belief. So they're more corporal punishers, whereas as a social worker, I'm like, nah, but there's different ways that you can respond to this. But just even having conversations with him now about what's happening, he's definitely like, he's not feeling these new cops or whatever, and how they're responding to things. And I have a cousin, she's passed away, but she's the first African American woman lieutenant in Rutherford County. And she was with Rutherford County Sheriff's Department for, I think, over like 20 years. But even her, she's a black woman first, and so before she passed away, all this stuff was still happening and still going on. It's interesting to have conversations with them, but at the end of the day, they black first, and they not necessarily, they want to see change just as much as we want to see change. And I was gonna tell y'all some things that my dad said, but I'm not. Off the air. But like, so they're black first, and they're human first, and there's different ways. I will say this, that my dad definitely believes in community policing, and that is something that's totally different. Because I have pictures of my dad when he was a bicycle cop, and they would be in the neighborhoods, and they were talking to people, and or if like listen to him and his partner tell us stories about like, you know, pulling people over and giving them second chances, or saying, okay, listen, you call somebody to come get you, and if you do it again, then it's gonna be a different story, you know. Just building connection and community with the people that you serve.
That's how it should be. You shouldn't be, people in your community that you're serving shouldn't be
afraid of you and not trust you, you know. And so that's major.
Yeah. I have a brother and a cousin, first cousin, and his father was a police officer. He retired about 5 years ago. So it's very interesting because overall they see the problem. I think their viewpoint is different. From their perspective, you know, their first priority is to get home safe. They're on a force where they have to enforce certain things, that a lot of mandates come down and they have to enforce those things. So understanding that and how to implement those things and how to see who's in front of you and what's in front of you and adjust according to that, I feel like a lot of where the problem is. And also too, they also mentioned too is training, like vetting before you get into the actual academy and apply intense mental health training, psychological training, and then when you're through, when you're actually like working, it's like, you know, training could be enforced more. But I mean, of course they're both black, and it's just it's very because they have real life experiences and they can see both sides. And one of the things that they both agree with is that it's important for them to speak up about the bad apples, because like you said, it's not all about cops aren't all bad. All cops aren't all bad, but
it's that system of like the immunity that happens when one
yes
does something and nothing
and if the police themselves, a lot of this wouldn't be an issue. Like if they came down harder on themselves, then it would it would take care of themselves. You know, it would the matters, I feel like it would relieve the frustration from the community that they're serving. It's like, okay, now we can have some type of trust because you're being accountable to yourself, and that way we can see what you're doing, you know, transparency and all those things like that. But it's you know, it's a difficult time to be a black police officer, you know.
I think when my cousin passed away, because she primarily worked in the jails, working with the Rutherford County Sheriff's Department, there were so many people that were inmates that reached out to me and was just like, you know, your cousin treated me with some human respect and decency, like she didn't degrade me. And I think that really mattered. Like, police officers need to see people as human. You have to see humans first. Because even like dealing with wild patients, let me say that. You know, and you never know, and they're unpredictable. You never know what you're going to get. I still see a human first, and it doesn't matter if you're white, black, yellow, or blue. You know, that's what I see first, and so I'm going to treat you like a human. And people also need to recognize, especially police officers, because you can get arrested just like everybody else can. You know, so we all put our hands on the same way, and we need to treat people with human decency, and I just think that will change and help a lot.
I feel like I had a lot of those conversations at the hospital you worked at, specifically with one doctor.
Oh.
And that's just because there were like times that like, okay, this black patient, she's talking loud, and this, you know, that's just how she talks. She's not being psychotic. She doesn't need medication, you know. But I think people forget to. I think people forget to like think about cultural differences. We're not all made the same way. You don't come from the same background. So, you know, of course we want to be all treated the same, but people just really need to educate themselves about stuff like that. And earlier I was talking about the treatment of like people of color, black people versus like white people. And I like read like an article about the guy that like did treatments on black women when like
The gynecologist?
yes, and that really shocked me because I didn't know that piece of information. Like he was doing experiments on black women because they were strong. And they were strong and they could take the pain. Yeah, and I feel like that's just something that's kind of carried on.
Yeah.
Like, you know, without people even thinking about it, you know.
That seems intentional.
Yeah, what he did was intentional. But I mean,
the
like,
practice of
viewing us as strong and like we can endure all this stuff.
That's definitely passed down from slavery.
Yeah. But shouldn't being strong kind of be like a compliment? So, and I'm not saying like, yeah, but so y'all not strong? Like, that's oh yeah, y'all need to do some self checks and look within and get your heart fixed because like, just because we're strong doesn't mean that we're not human. And my biggest question is, why don't you do yourself the same?
It's crazy. Now I think about it, like when people describe like black women especially, it's like they're strong, they're independent. Like, yeah, like can you not be strong and independent? Like,
Can you not be diverse in your personality?
Yeah.
Maybe not your hair.
Yeah.
But, I mean, because that was not shade. But like seriously though, can you? Because those are the type of things that we get compliments on a lot.
Right.
And then are they really like? Is that shade? You know? I think it's like, especially when you go to work and they're like, you always change your hair.
Right.
Thank you for telling me. I'll probably change it tomorrow because I have this wig on.
Like, that's a new person. No, I work with
it reminds me of that time when someone was like, "Princess, did you cut your hair?" And all it was, I just had shrinkage. Like, that's it. It was just shrinkage. I was like,
shrinkage.
no, it's called water. I did not cut my hair. Didn't get a new haircut.
I think the underlining of it all is like the origin of the compliment comes from a stereotype. Like if they marginalize us, they put us in this category, and it's like, oh, I can say good things about this or I can say bad things about it. I choose to say good things, but it still comes from a stereotype. You know, and that does allow you to be diverse and, you know, how you present yourself or be appropriately practiced when you're with a medical professional. Like, it's just like,
it's almost like a caricature to me of like you said, there are positive stereotypes, like how there's a stereotype that all people who are Asian are smart, you know, but it's still harmful because it takes away your need to get to know people individually. And I think like that when Princess you're talking about, I don't actually know who said it because I got it. But just like that we're strong and that we're sassy and you're like stylish, and it's like, okay, yeah, but there's more to me than that. And I think I was listening to a talk that Robin DiAngelo did. She is the author of White Fragility. She's a white female, and she was just talking about how white people in general don't view themselves as having a race or an ethnicity. They view themselves as kind of like the default. And so I think when a white woman is like funny or she's stylish or her hair is, it's just like she's just her. But like that is like that's how you define us. Like it's not, that's just who I am. But for her, that's not a label that you would put on her just because she like had a bad day. You wouldn't say like, oh, she real sassy. She's just that. But, and so I think that's, yeah, or like, Let's not start talking about us. Karen culture is a whole.
Oh, we need to talk about
Like, it's just that we're not allowed to be nuanced. Like, I'm not allowed to have a bad day at work. You see me at work. You had to be a bad day. It was not allowed. It was not. It was frowned upon. So it's like I definitely think like white people are kind of allowed to have. Are you talking about me? What? Because you know what? It's not fair. I've really grown. I've
I said
grown.
the opposite with you for I don't know how many years, and
You've had bad days too. But I've grown to realize, and it's sad, but I've grown to realize like you just can't have a bad day at work.
I believe that too, because sometimes I just close my door when I have my bad days, just be by myself, and my white parents would show up and be like, "What's wrong? Why are you so upset? I just need my space. Okay, I'm not mad at you. I just need my space. Okay?
But you're always supposed to be happy, didn't you?
Huh?
You're always supposed to be happy though.
Nah.
Okay, we have about like 30 minutes left. Do you guys want to answer some of the questions from Instagram? There's only like 3 or 4. So Cyrus, you should touch on. See, we didn't even get to. Wait, do y'all want to talk about Karen? I feel like that's a whole other discussion.
Karen, I mean,
that's a whole.
When I tell you, there are people in therapy, white people in therapy have brought up Karen. Like they're fed up.
Wow.
I was like, well, it's real.
Well, that's
I'm actually glad that Karens are kind because they've always existed. And so now
Putting a label to it.
I want y'all to find. I know what Karens are, but I want y'all to find it.
Let's define it for the people.
I don't have nothing.
Who wants to define? Who wants to define Karen? Or we can all do the sprinkle in. Okay, let me think.
Karens are the people that you work with that document all your movements.
Okay. But it's not their job description.
Yeah.
They're not the building security. They have an word
And
Excel
they
sheet.
send emails to your supervisor as if that's doing something. Karen, work your discharge plan and not worry about
This person, wow.
it. It is personal.
She got an Excel spreadsheet about Cyrus clocked out at 12:05. 12:40.
And she does. Yeah, she has.
I heard of that before I left.
Yeah, and I'm like, ma'am, they done moved you 4 different units and you over here with us. It's a problem. And I told her, I said, what you do over there is not gonna work up here. I'm direct. She said, I can't believe you said that to me. I said, yeah, I'm saying it to you. You need to do your job and excel at that and quit worrying about me. Cause mine is good.
That's what Karens do. They
Don't have
worry
to
about
excel.
everybody else but themselves. That's what Karen is.
Like, it's just like, I'm gonna come over here and tell you what you need to do.
Yes, ma'am.
You know, that neighbor comes over here and talks to you about what you're doing over here. It's like, what? Like, you know?
And I hate to be like that, but it's like, Karen's, I'm sorry, it's the white women, okay? You don't see a black woman in Walmart going, now you know you didn't pay for that. Is that yours? Is that yours?
Why is your mask on?
You don't see that stuff.
Meanwhile,
Like,
she's not working math.
I literally watch somebody in Walmart at the checkout, and I'm like side-eye, and I'm scanning my stuff, and she's watching this black couple. They're scanning their stuff. She waits till they pay. They get ready to leave. This lady does not work at Walmart, and she walks over there and she's like, "You didn't scan that bottle of water," and they're just like, "We did scan this bottle of water."
I was gonna say Karen's a good
And she asked for their receipt. I almost told them, "You
What?
better leave.
That's
You
why-
better leave." I left
Right. Are you?
But I remember, I talked about this other day. My first encounter with Karen, I was 16 years old. And me and my mom, we had just left church. We were going to the store. And it's foggy about like what happened. I just know that she called my mama out her name. She called my mama B-word. And so Courtney, back in the day, you know, I even saved my whole life. And so all I heard was her call my mama B-word, and then it was like, over with. Man, yeah. And
You was
Oh,
filled with the Holy Spirit.
Right?
We had heated fellowship.
oh, baby was gonna get blessed by a 16-year-old, you know. And so, but y'all, when I started to pop off on her, the tears hit instantly. Like crying. So Karens do that. They
That is
start
a key feature
stuff.
of Karen.
That's a key feature. They start stuff and then all of a sudden they become a
The
victim.
victim.
We
Yes.
I'm like,
Yes.
how did they come?
That's a talent.
And it's not even like one.
It's
It's like
they should be actresses. Like
Right.
that's a talent. You need fucking pictures. And my cousin that I told y'all about earlier, she she was like an angel. She just popped up out of nowhere. I don't know where she came from too, but we all had came from church. But I don't remember why she even came to Kroger. But my cousin came out of nowhere and she was still, of course, in law enforcement. I don't know what she said to that Karen, but all I know is that me and my mother were able to go into the store and shop, and Karen never made it inside. So, and I wish I could ask my cousin, what did you say to her? And that's another thing, you don't know people, you know, all you see is our skin colors, but you don't know who we work for, what we do, what type of power we have. So yeah, but Karen's, their key factor is, let me start something with you, but then let me play victim.
When the similar energy is returned, it doesn't have to be the same level as their energy, but it's just like when energy is given back to them, like the lady in the park, the man requested, yes, that she put a leash on her dog as the sign, you know, endorsed. But it's like you said, it's the segment of white women that have moved through life with such privilege, and it's like whenever that is like threatened, I don't know, it's something like
right now.
something blows up in their mind. I don't know.
This girl's watching his little inbox. She got nothing else to do. Watching his work, message the boss. He's not doing anything.
What?
I don't know. This invisible cape that y'all wear. Yes. But I think people need to start holding Karens accountable though. So if I'm getting an email about somebody else other than them and what they're doing, I'm gonna have to email you back and be like, please explain to me what that has to do with you. How is this bothering you, affecting you directly or indirectly? Like what's happening in your, or more importantly, what's going on in your house? Because for you to be so concerned about me, there has to be some type of lack of control or some type of chaos and confusion going on inside your home. Right.
We used to have Fortnite taken away.
But I got seen posts like white women are now getting upset about being called Karens, and there was one post I saw that said, but I saw one post where she was like, what did she say? The white women of color matter. White women of color. What does that mean?
Rachel Dolezal.
With them kinkies, when
she's like, Karen's unite, and
Rachel Dolezal might be the first kid.
No.
But it's interesting to see them. I wouldn't say that she was a Karen. She's something, but I don't know how to call her.
That's a definition of privilege. To just decide you're black.
Yeah, and she still hasn't, undecided, even though y'all read about her life. But it's interesting to me to see them get upset about being called Karen or being called racist. Call a white person racist, they will be like, I am not. You just can't go around calling everybody racist. You can't just go around calling people niggas because you feel like it. Like, so, I mean,
yeah.
You just ain't in. You should hate.
It's interesting to see the shoes.
They cannot handle it.
Okay, you guys, let's try to answer some of these Instagram questions. Well, I think there's one we already kind of answered. How do you balance? Oh, we kind of talked about how to balance the desire to stay informed versus your need to protect your mental health. I think Lisa touched on that. There was a good one about what are your recommendations for healthy, safe ways to date during a pandemic?
can't stand
Ready for the
silence.
chat? Look at you being safe, social distance,
Eating a donut.
anti-COVID. Y'all ready? Ready? Corona proof.
Essentially, whatever the document, like, we can